So our topic today is aging in place, and we're going to talk a little bit about the caregiver and what the role of the caregiver is in aging in place. So November is National Family Caregiver Awareness Month, and President Biden has signed a national declaration by the authority vested in him by the Constitution and the laws of the United States to proclaim November 2022 as National Family Caregivers Month. And so the Administration on Aging, which is part of Health and Human Services in Washington, D.C., has basically focused on family caregivers with the idea to recognize them, assist them, include them in discussions, support them, and engage with them. We're going to start out a little bit this afternoon with this statistic from the Harvard Foundation, which says that 71% of older adults are unwilling to live in a nursing home in the future. Given that as kind of a backdrop, if you will, one of the things that we need to start looking at as a society is to continue to figure out ways that we can provide caregiving in the home and what that role of the caregiver is. So we're going to look at a couple of things this afternoon just to see if we can begin to get some clarity on that. So the first thing that we're going to look at is, what do caregivers actually do, or where do they help? And probably most of you have some overview or sense of this. So the caregiver's role is basically, there are two types of caregivers that we work with at this point in time, either in the home or in an institutional setting. So family caregivers tend to be involved with what you would expect: household tasks, helping people with activities of daily living, helping them getting in and out of a chair, in and out of bed, providing emotional and social support, health and medical care, advocacy and care coordination, and surrogacy. So those are the kinds of things that basically family caregivers provide. None of that is really new to any of us. Paid caregivers can provide some of the same types of supports, if you will. The question then really becomes, do we have it done by family, or do we have this role done by paid caregivers? In this particular presentation, we're going to talk only primarily about family caregivers. So let's look a little bit, just as we kind of go through this journey of caregiving. So if we think about the cognitive and interpersonal relationships in terms of the caregiver's role, the caregiver is often burdened with continual, ongoing need for problem solving, figuring out how to get to the end that we need, making decisions either for or with the individual, depending again on their ability cognitively to engage in various types of decision making, whether that is for their own personal care, whether that is for the household, whether that is something as simple as ordering groceries. Caregivers also become, especially the primary caregiver, becomes extremely important in terms of communicating with family members, keeping the family informed, securing their assistance and support. As an individual requires additional care and support, then there is a further communication needed with both health professionals as well as human service professionals. And again, one of the things that I find is that oftentimes older adults are really not very able to express, if you will, the type of health information that is needed for health professionals to make good judgments as the individual becomes less and less able to use their own abilities to share information. Another thing, and I hear this very often from caregivers, is that the constant vigilance of feeling overwhelmed, of feeling like you are responsible, that you have such a burden as a caregiver in terms of making sure that you are taking care of the well-being of the older adult that you are working with, whether it is a spouse, whether it is a sibling, whether it's a friend, or whether it's a parent. How we approach caregiving really depends on, and how we manage it really depends on who we are as individuals and what our skill sets are that come to this caregiving situation. So if in our culture or our world, our household, our family dynamics, if caregiving is valued as something that is expected, and if it is something that we prefer or we want to do, we are probably going to be more accepting of that role. Whereas some families or some individuals believe that that is not part of their workload or is not something that they want to be involved with. And so they may very well find more stress and more concern, if you will, in terms of how they approach it. Knowledge and skills also make a huge difference as we approach that caregiver role. So if I am very knowledgeable as a nurse, as a social worker, as a physician, a medical professional, a psychologist, I might have a much different viewpoint about what I can and can't do, or what I bring to that caregiving dynamic. Another thing that gets very significant in all of this is how accessible is the healthcare system? Can we afford it? And is it adequate to meet the needs of the individual for whom we are trying to provide care? So cognition and interpersonal relationships play a very significant role in how we approach caregiving. Many of us are in situations where we are either the long distance caregiver or we are the primary caregiver, and the rest of our support system is in that long distance caregiver role. Long distance caregivers have a very different type of relationship, if you will, with the caregiving process. So long distance caregivers tend to provide more in the way of emotional and social support, meaning that they're the individuals who can call, you can brainstorm with, you can unload with. Sometimes they can provide support as well to the older adult themselves, because they can be in regular ongoing communication. Long distance caregivers sometimes have will take on the role of advanced care planning. Again, those are documents that can oftentimes be completed off-site, and then only need to have interventions once in a while. Sometimes we find that they provide financial assistance. They're not really able to move to the location where the loved one lives, so they might pay for home care, or they might pay for other expenses. Long distance caregiving also is somewhat conducive to care coordination, meaning, again, that is something that can be provided as long as you have a telephone. This is just a little graphic that takes us down the view, if you will, of how many hours do we spend in caregiving and what does that look like. So as you can see, if the caregiver is younger, they tend to spend fewer hours in caregiving. Caregivers who are 75 plus tend to spend about 34.5 hours each week providing caregiving. That's, the equivalent, if you will, of almost a full-time job. So when we see situations where people are having difficulty, if you will, managing as an older adult, as a caregiver, we can see that this is not necessarily easy work, and we're dedicating a lot of hours to that. So let's take a little bit of a look at the caregiving trajectory. Again, some of you may be very familiar with this, and some of you may, this may be new information. So part of the caregiving trajectory, and I've just picked out 3 particular chronic diseases. They look somewhat similar, but at the same time, they have some very significant differences. So if someone has a stroke, most likely we're going to see some type of sudden intensity in the need for caregiving support. And this may decrease then as the individual regains their function and gets to a point of stabilization. On the other hand, if someone has a lot of complications from stroke, or they have more than one stroke and they're kind of ongoing, then we may see a very significant trajectory in the sense that we may see a lot of hospital visits, a lot of rehab visits, a lot of emergency room kinds of things, with the individual's physical condition continuing to deteriorate and requiring a higher level of support from the caregiver. Someone who is suffering from cancer will most likely have a somewhat different trajectory, in the sense that there probably will be recovery at home after whatever type of surgery may have been done to halt the progress of the cancer. There may also be then radiation or chemotherapy. One of the things that we find is that individuals who have cancer and are going through that disease process, there often are lots of emergency room visits, lots of hospitalizations. They're pretty unpredictable, and the individual's ability to manage is often limited because of the pain, because of sleep, appetite. So again, as the cancer advances, especially, we see that there's a much higher level of, again, caregiver support and the ability of the individual to not be as involved in their own care, ultimately oftentimes ending in a significant role for end-of-life care and ultimately bereavement. People in dementia are going to find a very different type of caregiving need. This will start out relatively sporadic because the individual is able to, at some level, maintain their independence, but they need reminders, they need cueing, they need check-in kinds of things. And as they go down the dementia trajectory, what we see is that the individual is going to need more support in the areas such things as medications, finances, getting the housework done. And they may need a fair amount of emotional support. Next, what we see as the dementia advances is that there may be personal or behavioral problems. There may be a need for relocating the individual to a new setting, whether that's living with you or whether that is moving them into some type of a care setting. As they go down that trajectory, there may also be a need for more personal care, may even need some levels of acute care, and advanced care planning becomes extremely important, and eventually probably symptom control. So as we try to understand the caregiver's role, what we're really trying to look at here is how long what is the need? And as the need becomes more complex, what we find is that the family involvement will increase significantly. And so part of what we are also assessing then is what are the risks, the costs, and the benefits to the individual over time, and what is that involvement going to look like? Do we need paid support as we're going through this process, or do we have the family support that we need? The caregiver's role then can be very ambiguous. Many years ago, when I first started working in the area of caregiving, one of the things we often talked about was the need for a role reversal, which is that the individual providing the care took on really the role of the parent, and the parent took on the role of the child. We no longer tend to refer to caregiving in that frame of reference. We tend to, and we have learned, I think, that the role of the parent never goes away and the role of the child never goes away. But what we see is that as those roles continue, there is a need in the responsibility of what happens. Some caregivers are going to approach caregiving with a great deal of confidence, and they may others will find themselves that they are in a very precarious situation. They get frustrated with the unpredictability of the disease process. And so basically they find it more challenging, if you will. Another thing that happens in this trajectory, as we said a few minutes ago, is that the demands as the person goes through whatever stage is it, whatever disease it is, as they go through the middle and late stages, caregiving really increases in terms of complexity and the responsibility that you have as the caregiver for making almost all decisions depending on where you go. The other thing that happens many times in this situation is that people who are really unskilled end up taking on a very medical role. So you're giving injections, you're managing the diabetes, you are giving out a lot of pills. So again, that can be a very challenging piece of caregiving. Almost all caregiving will end in some type of end of life. When we get in these situations, most of the time the individual does not improve, and even if there is a temporary or preliminary or temporary improvement, it may not be very long term. As we go through and have to look at end of life decisions, again, caregiving becomes much more demanding. But for some people, this also provides an additional opportunity for better meaning and purpose as they are part of at the older adults and end of life and care. We're also going to see probably more hospitalizations as the health declines, and we're going to move then from basically disease management to some type of supportive service. One of the things that we know in terms of caregiving, because of the stress, et cetera, and all of the new roles that we take on, is that the role of keeping the caregiver healthy and providing for care for the caregiver is as important, if not more important, than providing care for the older adults. So this is just a graphic with some tips on family caregiving. So you should create some kind of a support or peer group. This gives you the opportunity to share what is happening, to share your feelings, whether you're sharing them with your other family members, whether you're sharing with individuals from the community in a support group. That is kind of your own choice. If you're sharing with family and friends at church, whatever works for you. Self-care becomes extremely important, and keeping your own health up. I often tell people that if I am working with a family, if you, the caregiver, are not healthy, then that's not helpful to the older adult, and it's not helpful to me as I'm trying to help you navigate the situation and provide the best care that we can. Acceptance, regardless of where you are, is extremely important. accepting the situation and accepting offers of help. Many of us think that we can do this alone, that this is, if you will, our responsibility. Try not to adopt that particular frame of mind, because if you accept those offers of help, it will make your life easier. The other thing is that a lot of people will offer to help, but at the end of the day, they don't come through with very concrete kinds of things. So people will leave your house and say, call me if I can help you. Well, what does that really mean? So I always try to encourage people in that moment to say, would you be willing to come by on Thursday afternoon at 2:00 and take whomever I'm caring for a cup of tea while I go have my hair cut, or whatever it is that I want to do. I take a nap, so that you immediately capture, if you will, that offer of help. People will usually not say no in that moment, but you then often, as the caregiver, do not initiate, if you will, that offer, or initiate a request to take advantage of that offer of help. So again, it's just a matter of helping you as a caregiver do your job more effectively. Communicating with doctors and other kinds of health professionals is extremely important, because you are going to become that primary voice for your loved one. As their ability to make their own needs known, you will find that you need to report more about either what you have experienced, what you have observed, and that the individual will be less and less able to articulate their particular needs. Taking breaks is really important as well, whatever that looks like. If you have the ability to do respite services, if you have the ability to share those caregiving burdens or tasks with other family members, or if you're in a position to hire some support, that becomes also really important. Some people become very depressed when they are going through this caregiving journey. And again, just being aware of your own emotions and your own responses. I'm a big believer in technology, so whatever you can do to use technology, please access it. And whether that is reconverting your home to a smartphone with various kinds of gadgets, including things like, robot vacuum cleaners and mops that scrub your kitchen floor, whether it's, doors that open, whether it's medication reminders, whatever it is that technology looks like. I am a big believer in that. One of the things is that helps you when you're too tired or you're not ready to really take, to be able to do whatever that task is. Medical information also needs to be very organized. I can tell you from personal experience that when you are working with 5 or 6 or 10 different medical professionals, and in addition to that, you have had numerous office visits or doctor's visits or hospital visits, things become kind of blurry. And so you're not always able to remember who the medical professional was, exactly what they did, where you were. So getting that organized is not only important from the medical perspective, but also then from the payment and financial side, as well as the insurance. Legal documents are always going to be a significant part of any caregiving journey. If you are needing information about what that should look like, I would invite you to check out the Advanced Care Planning Toolkit, either on our website or go to our YouTube channel which also has quite a bit of information in a advanced care planning playlist. And last of all, let yourself off the hook. Take credit for what you can do, but at the same time, give yourself the kudos that you enjoy and accept those graciously from people who indicate or provide that kind of two-way communication. When somebody says you are doing a good job, accept that graciously and thank them for noticing. This is just a little bit of a hint on emotional self-care. Again, this is don't suppress your feelings, but make sure that you acknowledge those feelings, those emotions, so that you can process them. Many times people who are caregivers are extremely hard on themselves. So again, practice forgiveness. And those of you who are in a situation where you can provide support, give the caregiver, as they're going through that journey, permission, if you will, to forgive themselves. Sometimes we find that people are what I call so hard on themselves because they believe that they have either not done enough or they have failed. Give that person permission to get rid of those feelings and compliment them on what they have done. Sometimes we see that people who are providing caregiving and who are in this role are still working professionally. So again, looking at that work-life balance, what does that mean related to your caregiving responsibilities, but what does that also do to your career? Or what does that do to the job that you have outside of the home? So again, exercise and nutrition are extremely important, as well as mental and emotional support. One of the things that we really suggest is what kind of benefits might be available through the workplace. And we're going to talk a little bit about those at the end of this presentation. Other things to do is look at things like meal planning. Where can you take shortcuts? Where can you get support? But most of all, again, this last one is self-care. And what is it that you can do to, as I call it, put something back into you so that you can proceed both with your work tasks, your career tasks, as well as your caregiving tasks. Another thing that becomes important in terms of self-care, as one is trying to provide care either when one still works or if someone is doing caregiving full-time, is organizing the paperwork. The paperwork can get overwhelming very quickly. Everybody wants to send you information. You need to collect information, whether you have that in a digital form or whether you have that in a paper form. Organizing it is extremely important. And again, because this allows you to feel in control. When things like the paperwork or you can't find things are not easily accessible, then you feel out of control. Technology, as I said, is extremely important. If you don't know how to use technology, I invite you to figure out how to do it, because again, it does make things easier. It is so much easier when I can pull up a power of attorney or a telephone number on my cell phone or a previous email or a record when I am in a situation, rather than having to come back to the office, remember all of the things I need to take with me, and then not be able to find them. The environment that you need to look at, that you should work in, try to create healthy and happy environments. One of the things that we're going to be doing over the Christmas holiday is what we call a holiday joy squad. And we are suggesting that people do 15 random acts of kindness to anyone for any kind of thing, just to, again, try to bring happiness to people. We all need to laugh more. We all need to feel good about who we are. And sometimes you will see mental health professionals suggesting that laughing is the best medicine that you can get. Self-care also requires that you accept whatever it is that your role and responsibility is. So the more time you spend whining and complaining about your burdens or what you have to do, the less time you will spend in that happy place. And the more time you will spend in that depressed and upset place. So finding your position, what you want to do is important. And then lastly, you want to keep everyone safe. Safety is one of those basic needs that we all have. If you go back to Maslow's hierarchy, safety, self-care, or safety, security, and food are basically the primary needs that everyone has. For some people, spiritual care is also important. And again, this does not necessarily mean that we are going to an organized religion. It very well may be. And I'm working with a family member right now where the organized religion is extremely important. But for other people, it could be more spiritual. It might be more in the way of meditation or yoga or being able to express yourself, connecting with nature, having quiet time. Again, we all are very different in the way that we connect, if you will, with ourselves, as well as with our greater world. And what the really most important thing here is being mindful, knowing who we are, and being able to be in touch with that mindfulness. So this is just a couple of more tips for people who are caregivers to relieve stress. So one of the important things is accept the change. It is going to happen. There isn't anything you can do. If you are not able to accept that change, then at the end of the day, again, you will create a sense of resentment. You will create for yourself depression, and you will not find that point of mindfulness and taking care of yourself. We also recommend that you be physically active. Again, the endorphins in your brain tend to work better if you are moving. You don't have to necessarily be doing calisthenics or running or doing those kinds of things, but getting up, moving around, going for a walk, going for a swim, all of those things make you feel better. They also make you less prone to various types of chronic illness. Reach out to others. Again, a support system is extremely important. You need to have people that you can do things with. If you harbor the thought that your loved one for whom you are providing care cannot manage even for some short period of time without you, then that is not a healthy place to be in. So to be in a more healthy place, you need to identify how you can create those social networks, and then you need to provide for the safety of the individual that you are caring for. Sleep is one of those, again, things that's extremely important. This too can be difficult, especially with some of our dementia patients, or as we're going down that caregiving trajectory where people need more and more support. So thinking about what does that look like? For some people, that might be hiring once or twice a week somebody to stay with your loved one. It might be that you would look at more exercise for the loved one so that they sleep better. There's a lot of different strategies, if you will, But again, making sure that you are getting an adequate amount of sleep is important. And again, as we said a few minutes ago, give yourself credit for all of the hard work that you do. This is just another way to look at how to take care of yourself from the National Institute of Health. And so these are some hands-on concrete ideas. So make time for a hobby that you enjoy. Again, this gets back to that taking care of yourself. And if you are not able to carve this time out because of the high demands of need for your loved one, then think seriously about accepting those offers of help from other people in your support group. And whatever that looks like and makes sense for you, that's what your wheel should look like. But if you are a caregiver, make yourself a wheel like this and put 6 things in it about how you're going to take care of you. And then once you put them in the wheel, then make sure that you find ways that you can do all of those things on a regular basis. You may not need to do them every day, but do them at least frequently. So the next thing I'm going to spend a little bit of time on is the cost of caregiving. One of the things that happens when people go down this journey of caregiving, especially when we are looking at adult children who have a parent move in with them. Oftentimes at the beginning of that journey, there are not a lot of expenses because mom or the parent is able to be relatively independent. There's not a lot of expenses that go with that. However, as time goes on and there are declines, we start to see that there are also then additional expenses. So this could be that the health conditions get worse, could be that we have to install additional supportive devices. It could be that we have to buy new or different equipment, such as a bed, such as incontinence products. What we also see then is that costs can go up because as we spend more time as the caregiver providing care for our loved one, then we also see that we are spending less time on other things, or if we are specific about wanting to stay very focused on our own needs, which is a good thing, then we end up hiring paid caregivers or paid yard work or handyman or things that we might have done previously to ourselves. We also find that we're spending more money as time goes on because our health needs change. And so then our loved one either doesn't have the funding to pay for it themselves, or we have to make other kinds of structural changes. Oftentimes people find that as the health of an older adult declines, there is less available cash to be able to actually provide for the rent and medications and insurance and all of those kinds of things. So it is a well-known fact that caregiver households do lose income because of the increase in expenses. And then that oftentimes also leads to various kinds of stress and then additional medical costs. So as you can just see from this graphic, as we go down that trajectory, we're spending more and more money. I put this in here just to give us kind of an overview of what are the costs of long-term care. This was put out by Genworth. Genworth is a nationally recognized insurance company that does annual surveys of the cost of home care, nursing home care, and assisted living. They've been doing this for probably 20 or 25 years. You can drill down to look at these costs specifically for certain states and for certain parts of the state. This is just the national one that I looked at last night. So in 2021, a nursing home was for a private room was costing about $108,000. Even in the Medicaid world at this point in time, in terms of nursing home care, the state is paying approximately $95,000 to $100,000. Assisted living is a little bit cheaper by about half, but again, the person's health is not quite as compromised at that point in time. But we saw a significant increase there as well, going up to about $54,000. While we think sometimes that home care is cheaper, this particular study looks at home care with an aide, someone coming into your home for some period of time, whether that is full-time or part-time. If you're looking at kind of a full-time home care aide, you're looking at about $61,000, $62,000 a year. If you're looking at a home care person, which this is somebody to come in and do the cooking and the cleaning and those kinds of things, you're again looking at about $60,000. So home care and assisted living, while cheaper, still are very expensive. So Colorado has a couple of policies that I want to take a quick look at. I'm going to end up having to go through those relatively quickly due to time. But these are some ways to pay for or to get some relief for caregiving. So in Colorado, we have access to 5 different types of programs: Healthy Families and Workplace Act, or paid sick leave, the Colorado Family and Medical Leave Insurance Program, or FAMLI, Federal and Medical Leave Act, or FMLA. If you don't have much money, you might also be able to get paid for some of your caregiving services through either the in-home support services or the community-directed attendance support services. So let's just look real quick at the Healthy Families and Workplace Act. This is the paid sick leave. This is a Colorado statute. And what this basically says is that all employees are able to earn a total of 48 hours of sick leave per year. It is mandated for all employers. If you are working in a company with 16 employees or less, they are required to provide this. If you have some unused sick leave, you can accrue and carry that over to the next year. And while you are using your sick leave, you can still continue to accrue benefits and additional paid leave. You can use your HFWA, or your paid sick leave, for anything that prevents you from working, whether you yourself need the support because of a physical or mental condition. You can go, to doctor's appointments. You can actually get care or treatment, whatever it is that you need. You can also claim it after domestic abuse, sexual assault, or criminal harassment. And you can use it for care of family members. And this includes older adults as well as children and other family members. The FAMLI program, the Family and Medical Leave Insurance Program, again, is Colorado law, was passed a couple of years ago by the voters of Colorado. If you, in addition to the paid leave program, every employer also has to offer this FAMLI program. So in this situation, if you work in a company that has more than 10 staff, then everybody has to pay this tax. And this tax is 0.9%. The employer pays 50% of it, and the employee pays 50% of it. If you work in a organization that has less than 10 employees, the employer does not have to pay the tax, but the employee does. So this is a way basically to fund this family medical and leave insurance. You can get then 12 weeks of paid leave for qualifying events. And if you have a complicated pregnancy or childbirth, you can get another 4 weeks or up to 16 weeks. In order to be eligible for this paid leave, you receive somewhere between 65 and 90% of your wages. There is a formula that the state will use as they implement this program. You cannot be terminated if you have worked for this company for at least 180 days, which is 6 months. And although we all will start paying into this fund January 1 of 2023, you will not be able to get the paid leave until January 1 of 2024. So this is just the timeline in terms of how the family medical leave or the family sick leave will work. The FMLA is the federal program, and basically that has been around for a number of years. FMLA, and again, employers have to participate. They don't really get a choice. You get up to 12 weeks off, and you can use that to either care for yourself or a partner. Now, the federal program, although you get the 12 weeks, it is not paid. Okay, so in theory, you could get 24 weeks off using the Colorado program for 12 weeks, and then you could use the federal program being paid for the state portion of the 12 weeks, but not for the federal portion. Employers really don't have a choice. If you have been employed for at least 12 months, or you have worked part-time in the last 12 months, then you are entitled to FMLA. But you do have to work in a company of 50 or more for the company to be required to make that available. You can use your FMLA however you want, again, caring for anyone in your life. You can use it for family members, you can use it for yourself, you can also use it for military-related events. This just reconfirms who is a covered employer. There was a period of time when public agencies did not have to be involved, but now, regardless of the size of the public agency, so a public agency, they don't have to employ 50 people or more. They have to give it to you, and a school or a public or private school, they have to offer it as well. And the eligibility is the same. The last two programs that we have here is the in-home support services. In this particular program, the state of Colorado makes available to individuals who are on Medicaid, someone in their life, usually a family member, who is their caregiver, and they provide personal care, homemaker, and home maintenance or health maintenance services. You do have to be approved by the single entry point, but then you can be basically paid for providing these kinds of services. So this is help with activities of daily living, help with housekeeping and meal preparation, as well as if there are any skilled services that might be provided by a CNA or a nurse. And this could be things like changing lidocaine patches, it could be tube feeding, anything like that. The one thing on the IHSS is that the client has to be, in theory, able to direct their own care, but that can be done again by a surrogate or a power of attorney. So they need to be able to interview the person who's going to be providing care, make a hiring decision, train and supervise them. The other benefit of going with the IHHS system is that you actually work for a company. They take care of all of the human relations requirements, all of the filing of Social Security, all of the payroll, and that kind of thing. So you're on their payroll. They also can provide 24-hour backup services if you get sick and you're that person who is the attendant. And they also have a nurse on staff who can provide supervision. So the difference then between the CDOS program and the IHSS program is that CDOS stands for the Consumer Directed Attendance Support Program. This too is a Medicaid program, works very, very similar to the IHSS program. You do have to be on Medicaid and you do have to have the care approved by the single entry point. You can provide the same types of services with housekeeping and laundry and meal prep and bathing, etc. However, in this situation, instead of the caregiver or the attendant or the individual working for a home care agency, they work for you, the older adult who needs care. So in this kind of a situation, basically, you have to be responsible for everything. You don't get the support of the agency. So the client is responsible for doing all the interviewing and training. You do have to use a financial management service. You submit your hours on a regular basis, and then they do send you a check. And that was put into place a few years ago because we were finding that the caregivers who were in this role were not necessarily using those billing correctly and using those dollars for what they were meant to be. You do have to do a CBI check, and you are eligible for sick time in this dynamic. So that ends my conversation today with you about caregiving. The next couple of slides are just a little bit of information specifically about services that are provided by the Colorado Gerontological Society. We do currently have money for vision and dental services. The vision services are available in the Metro Denver area. We will take your application, but we do have quite an extensive waiting list for hearing services. Our dental services have expanded to west of I-25, except for Pueblo and El Paso counties. So if you need dental services in one of those counties, feel free to sign up. In keeping with the caregiving idea, if you, again, is one of these ways to provide yourself some self-care, we do have a telephone buddy program. And if you are caring for a loved one and would like a telephone buddy to call them once or twice a week, again, to provide you with some self-care, please feel free to call our project manager and she can assist you with that. Other services that we provide are listed here, and they're primarily, again, in that to support families, older adults, and caregivers. This is just a little bit about our education and advocacy programs. If you are finding yourself needing to look for resources, you could request a copy of our senior resource guidebook. That is available. We can mail it for $10 a copy to cover postage and handling, or you can go to the library and pick up a copy. In addition to that, we have our housing and home care locator, which is a lot of the same information on our website at senioranswers.org. And I would invite you to look through that housing and home care locator. There's a big blue button right at the top of the home page, and that can help you search for home care, help you search for assisted living, other types of housing alternatives, hospice care, adult day programs. So again, congratulations to all of you who are family caregivers. We celebrate you on this month of November, and kudos to all of you who are providing those services. Thank you for that.